on well-being, mental health, trauma-informed care, as well as substance use, and specifically as well as telehealth in those aforementioned content areas. We focus particularly on capacity building, as you know, and we do this through free training and consultation that you can seek from our website, as well as shared learning opportunities that we call Learn. They are collective learning opportunities that usually last around 6 months, and we also offer a stipend with it. Grant making, which you're on this webinar today to learn a bit more about our transformative grant that is live right now. As well as small grants. We actually just had one. It was live for about a month, and we're currently reviewing applications. And we also do a host of community engagement. One is certainly the work that we do with the Sustain Advocacy Group, and we do continuous engagement through listen-in sessions as well as stakeholder discussions. All right, I'm going to pass it over to Marcus to talk a little bit more about our guiding principles.
Thank you, Dr. Ali. Excuse me, everyone. As it relates to the Sustained Wellbeing Compass Coordinating Center, and as it relates to the Compass initiative as a whole, we as CCs have decided that we, should have a roadmap or a guiding principles of how we do our work and how we work with each other, how we work as an organization, and also how we how we work with our organizations, and then how our organizations will work through their project. And when thinking about this, we agreed upon 4 guiding principles as it relates to the way that we are doing our work. Our first guiding principle is the meaningful involvement of people living with HIV and AIDS. And this is because we understand that with these projects, you will be serving individuals who are living with HIV or most impacted by HIV. And with that being said, their meaningful involvement is very important with the projects. And by meaningful involvement, we'll talk a little bit about, we'll have actually a little bit in the presentation about what that looks like, what it is, and why it's important. We also recognize that we cannot do anything without recognizing the intersectionality between social and racial justice, and emphasizing racial justice within that. We understand that we are living in a times where now Blackness is criminalized, and we also have to pay attention to the ways that systems and structures are systematically set up, and understanding that we have to recognize those barriers in place and institute projects and things that are in place to actually help eliminate those barriers. We also have the principles of openness, transparency, and learning, with understanding that with an openness comes transparency, and with transparency comes learning. We cannot actually work within if there's no need actually to be worked upon, there will be no need for the grant. So we understand that it may be a little bit difficult, but when working with each other, we would like to have that openness, transparency, so we can learn. And also, as it relates to the guiding principles and the way that we work in a collaborative and a committed way, meaning that we don't work in a hierarchical way. We understand that we will both be learning from each other, so we work in a partnership. And through these guiding principles, what we would like to address are the social determinants of health, also ensuring that gender affirmative care is at the top of our list, as well as healthy sexuality and sex positivity. And with doing our work, what we'd like to do is affect change on a multi-level approach. That means just not working with individuals, but also working with individuals, systems, and then also working on the macro level, or what it looks like for community. All right, so let's talk a little bit about why we're here today. So today we're here to talk about the Transformative Grant, which is the opportunity that provides grants to organizations across the Southern United States to support the development of new programs and activities that are aligned with the programmatic focus areas of the Compass Initiative. We would talk a little bit specifically about what are the focus areas for the University of Houston a little bit in the presentation. But through these transformative grants, what we're trying to do is build overall capacities for organizations across the South. And what does that look like? So with transformative grants, you can request up to $100,000, and specifically for the University of Houston, you would have to include a minimum of 10% and a maximum of 30% within your proposal for training and consultations. And this is included because this is a capacity building grant. So what that means is that you should be learning something new or building a skill to actually implement a new program. Also, it's very important to know that you can only apply to one center. And we also are encouraging proposals that are led by or that are centering communities that are Black and Latinx communities of transgender and non-binary experience, Black same-gender loving men, gay, bisexual, or queer men, as well as the Latinx communities and cisgender Black women. As far as eligibility requirements for the transformative grant, you have to be located in the 9 deep South states, which is Alabama, Florida, Georgia, Louisiana, Mississippi, North Carolina, South Carolina, Tennessee, and Texas. You have to have a 501c3 designation or have a fiscal sponsor. The grant period for the transformative grant will be from January 1st, 2020 to December 31st, 2020. And you also will be asked to complete a organizational assessment. And then also you will have to agree to work with the evaluation partners at our CC or at our coordinating center, as well as with our evaluation partner for the whole initiative, which is ECR. As it relates to unallowable activities, they are outlined in the RFP, but I wanted to pay very close attention to the first unallowable activity is that the projects that you all are proposing cannot focus on or include prep in your proposals. And as I stated, there is an exhaustive list of the unallowable activities and also prohibited expenses within your RFP. So I just encourage everyone to read through the RFP. And I will transition over to Dr. Ali to talk about our content areas.
Great. Thank you, Marcus. Digging in a bit deeper into our content area. So the first one being wellness, right? Well-being and wellness is an active process of becoming aware of and making choices toward a healthy and fulfilling life. So these types of programs could include physical health projects or interventions or programs. They could include spiritual ones, yoga, meditation, as well as employment programs. And these are really getting at like treating communities and the people that we work with in a whole way. And so we really encourage you to kind of think outside of the box and think about the ways in which you can create projects that address the whole individual. Moving on, our second content area, and no order necessarily, is mental health. These projects can include reframing of mental health services at your organization. Again, these are just broad examples. Development of assessments or screeners, perhaps, or enhancement. You're not quite liking the ones that you're doing, or you feel like they're not effective for certain communities. So you might want to develop a new one. Trauma and development and implementation of trauma-informed services that includes organizational transformation as well as more interpersonal transformation. And then last but not least is healing justice approaches to your service provision. Moving on to substance use or misuse. We're paying very particular attention to the opioid epidemic as well as harm reduction approaches. So, you know, thinking about, are there programs that and projects that you can create that are harm reduction oriented in nature, that are specifically tailored to communities that have been suffering from the opioid epidemic. And some of the states that are listed before are certainly a part of have seen the epidemic on pretty rampant levels. Last but not least, telehealth. So telehealth has been used increasingly to reach communities that are either living in rural areas and don't have immediate access to mental health services or harm reduction oriented services, or those that are there's a barrier to transportation, right? So this could be services that you create and implement using technology such as video conferencing or smartphones. I'm going to skip over this. All right, so moving on to key aspects of the RFP. We're going to now spend the remainder of our time, and we'll have a bit of time left for questions at the end, discussing the meaningful involvement of people living with HIV. Capacity building, we often hear the word, and today we'll talk a little bit more about what it means, since these are capacity building grants. And lastly, we'll also talk about some key questions to consider and reflect upon when you work on your work plans that are required in the proposal that you'll be submitting. So I'll pass it over to Eddie.
All right, so let's talk about MEPA, which is Meaningful Involvement of People Living with HIV and AIDS. So what is it? It's centering the most impacted on all decision making. So making sure that people who are most impacted by HIV are involved in decision making process. Recognizing that people living with HIV or the most impacted are experts on their lived experience. So allowing people who are living with HIV or most impacted to live in their own truths. Seeing the important contribution people living with HIV can have on a program design and implementation, and knowing that all involvement is not meaningful involvement. So making sure that the involvement is really true and not just a tokenism, such as creating a CAB or other bodies that have a real impact on how decisions are made. CABs are crucial to program implementation, and that is a definite way to make sure that you're involving people living with HIV. And also hiring staff that is reflective of the community being served, making sure that your staff represents the community. So what is it? It leads to better decisions and responsive planning. It gives you a real connection to the community. It allows for a reduction in stigma and discrimination. And it also has an increased effectiveness on your policies and your programs, and is building a sustainable and shareable power in communities, as well as holds organizations that serve us accountable to those living with HIV and AIDS. So now we're going to take a poll. We're going to have MEPA in action with real world examples. So we have two organizations here, and I want you to tell me which one is actually implementing MEPA. So we have Organization A. It is led by non-people of color living with HIV. They have people living with HIV, but they do not help create CAB agenda or lead the CAB. They provide employment for people living with HIV and great support. They have people living with HIV giving input on website graphics and webinars. And Organization B is founded and run by Black, gay, bi, same gender loving men. They also employ people living with HIV. They have all programs designed by and for people living with HIV, and all governance boards are led by people living with HIV. So now we want you to participate in our poll. So which organization is utilizing the principles of meaningful involvement of people living with HIV and AIDS? Is it organization A, organization B, neither organization, or both organizations?
All right, going to give everyone about 5 more seconds.
Okay. Looks like we're seeing a lot of organization B. But what we actually know is both organizations are implementing MIPA. Knowing that MIPA is a spectrum, we know that both organizations provide employment for people living with HIV and great support. So although the entire aspect of organization A is not compared to organization B, they still employ MIPA in action.
And it's important to understand that with you all's proposals, even though you all may not look like organization B, this slide was to let you know that there's some way to incorporate MIPA into your organization, even if it's starting at block 1, but understanding that you can move forward. And I'm gonna talk a little bit about what it looks like around incorporation of meaningful involvement into your proposals. What that looked like is you're clearly discussing the work your organization within your proposals, clearly discussing the work your organization is already doing as it relates to MIPA, and then also how you all have incorporated the principles of MIPA in developing your proposal. And with that being said, if that is something that has not been done, that is totally fine. It's totally understandable. However, just talk a little bit about how you plan to incorporate those principles into your proposal. And as it relates to MIPA, be explicit. And what that means is being intentional around those principles and not having that be a checkbox, but having that be an incorporation of the way that you do your work. And what that looks like is being committed to building the collective leadership and the power of the people who are serving the organization. And that looks like providing professional development opportunities. Are those trainings that are going on within organizations? Are you providing those opportunities for the individuals who are members of your CAB? Are there advocacy or leadership training opportunities or mentor opportunities that could build the professional and personal development of the individuals helping to inform your program? Are there technical skills training or supports that could be provided to those individuals who are helping to build the organization as a whole? And also discuss how MIPA will be incorporated through all phases of your project. And what this looks like is being committed to the MIPA principle by first acknowledging that there is always room for improvement. Also recognizing the importance of economic justice and paying individuals for their participation and for their lived experience. And with this economic justice piece, this is also, if you are continually relying on individuals, a $20 gift card may not be enough to suffice the contribution that they're giving to the organization. So just make sure that you're being economically just and paying your individuals who are providing that experience. And also expanded beyond those quote unquote go-to individuals in HIV leadership. So that's going beyond those individuals who traditionally have been in the spotlight and talking to individuals who may traditionally have not gotten that spotlight and seeing whether their perspectives. And I think it's also important to note that this information is not information that that I have came up with. The presentation information around MIPA was actually developed by the Positive Women's Network, and specifically Ms. Vanita Ray, who's the chair of our SAG, and our SAG is our Sustained Advocacy Group, which is comprised of one individual representing each of the 9 Deep South states who's living with HIV and out about their status, who has informed this Compass initiative, specifically the Transformative Grant and the Compass initiative as a whole since its inception.
Great. Thank you, Marcus and Eddie. I'll spend a little bit of time talking about capacity building, and I think everyone will agree that it's especially in the past 5-10 years, it's a word that we often hear, and you know, it is a black box of many things. So we wanted to provide a bit of context as to, as you know, and this is also in the RFP, as to what we mean by capacity building. So you know, on a whole, we build capacity through enhancing knowledge, right? We want to learn to change, right? We want to also change attitudes. For example, the centering of people first language is very important for us at Sustain. However, that comes with it, you know, we have to increase our knowledge to actually change the attitudes, to actually do the thing, which is using people first language. And then learning skills, right? Learning actually how to do it. And these three things combined, we believe, will create action to transform the South, right? This is what the transformative grant is about. So again, enhancing knowledge, changing attitudes, learning the skills to create action in your organizations and your communities, right? How do we do that, right? So we know what we have to do. How we do it is we learn, right? This is why training is an allowable cost. And in fact, you can spend up to 30% on training. We know training is essential. We know continued training is essential for your projects, as well as sustainability and buy-in in your organizations about a new concept or about a new project. And we know continuous TA is also really important. So that's one way capacity building works, is you learn through a training, you apply the knowledge, change your attitudes about a concept, or you know, the way you've been doing something, and then you apply the skills, right, to create that change. So this could be in the form of, again, organizational transformation. You know, for example, trauma-informed care. You want to change your organization to be more trauma-informed. That means from the waiting room to, you know, really from the parking lot to the back parking lot, right? Anything in between, you know, you'd be changing to be more trauma informed. And that's one example of certainly a capacity building project, as well as other pieces, a new project or a program, a new screening tool you want to implement, um, as well as perhaps a new group that you want to develop with the community using MIPA principles. Is also capacity building. And then the other piece is creating a new alliance or network that's intentional in nature. Again, in our content areas, you want to perhaps enhance referral services in your locality, and so you know, you want to create a network for a smoother warm handoff, perhaps, or a referral of some sort. So these are all examples of capacity building. We wanted to provide you with a little bit more operational before, you know, as you write the grant. A required component of the proposal is a work plan. So we wanted to talk a little bit about, I know I think many people might have done a work plan of some form. And we've provided you with a template to fill out. Please use that template. We've also provided you with definitions and some questions to think about. So I'll go over SMART objectives really quick. Again, I think it's something that we've all heard of. When you're actually doing them, sometimes it's very difficult to actually come up with a SMART objective. It's challenging. We encourage you to work with your team to come up with these SMART objectives. So really quick, objectives are meant to be specific. We want you to be very specific about who and what type of project it is. Use action verbs. It should be simple, sensible, significant. We want your objectives to be measurable. That means that we want you to be able to pretend how much change is expected, right? A count or quantity of some sort. Or if it's more qualitative in nature, explain that as well. We want you to be achievable and successful, right? So think about your objectives, um, you know, as something that you want to be successful in doing, right? So within an attainable time frame. If you feel like your training objectives are going to take you 6 months, they're going to take you 6 months, right? So we want you to also be accountable to yourselves when you're creating the objectives. Relevant, obviously we want it to be relevant in your scope of the project. So whatever you're writing in the project should also match up with your work plan. It should be relevant to how you're envisioning the work to be. So these aren't two separate things, right? That whatever you're writing in your actual project is informing your work plan. The work plan is how you do it. And then time bound, right? We want you to think this is a year project. So we want you to be also, right, very feasible and accountable to yourself around what can I actually do in this proposed time frame, and create your objectives accordingly, right? And a couple of things to think about as you work through the work plan. What do you want to achieve, right? Sometimes starting with the end is the best ingredient, right? Because you have a vision, right? What is that vision? Is that vision that you want to be more gender affirmative in the way that you're providing care? Then you work backwards. How do you do that? Well, you don't know how to do that, so you're going to get the training to build your knowledge and skill set to do that, right? Objectives, we just went over them. How will you accomplish this broader goal, right? So we want you to put key action steps. What are the things that you actually have to do to meet that objective, right? Again, time frame is very important. And in some ways, most importantly, who's actually leading this piece of labor, right? Who is the person responsible to actually complete this task? And we want you to really think long and hard about that, because there might be multiple people holding up multiple pieces of your project, right? And that's okay. But I think thinking about who are those people is important. And then ultimately, what is your expected outcome? What do you want to occur as a result? Definitely be a visionary here, because I think it will impact the way you're thinking about your work plan. And this will be familiar for those of you who've looked at the RFP already. We've included this diagram for you that has a host of reflective questions as you fill out your work plan, right? And we divided it, and we suggest you using the phases that we've outlined here, right? Phase 1, right? And this is all kind of summing up what I just discussed. Learning, enhancing the skill or concept, right? What are the things that you need? How many hours of consultation should be scheduled before and after the training? Consultation is really important before and after a training, so you want to account for that in your budget. How do you plan to garner support for the project at all levels of the organization? How are you going to secure buy-in, right? Because new concepts do require buy-in, right? Whether people agree or not. And then what are the resources you already have to support your project, right? We want you to think about these things as you're developing the work plan. Phase 2, the actual development. How are you going to incorporate the voices of people with lived experiences? How will you incorporate what you learned from phase 1, from the training, into the project, right? And then who will be involved in the implementation when it actually begins? Going back to the piece of the work plan to think about, I think if everyone could mute, that would be great to minimize the noise.
I'm about to click on right now. See what's going on. Just open up my email.
And then phase 3.
Can everybody mute your phones, please?
Thank you, Marcus. To actually do the project, right? So you have to get through these couple of phases to actually do the thing, but then you've set yourself up for success, right? How will you know your project is working, right? How will you evaluate your progress? Like Marcus said before, you'll be working with our local evaluator as well as and then as well as ETR, which is our Compass evaluator, you know, to kind of like what is working, right? And how will you know your project is successful? And I'll pass it over to Marcus to discuss some examples of funded projects.
Thank you, Dr. Ali. Before I talk about the examples of some of the projects that we have previously funded, I just would like to let everyone know that these are just examples, and no way is this list mean to be prescriptive in the way that you all are writing your proposals. These are just examples of funded projects, just for you all to note rather. And before also going into these funded projects, I just want to talk just briefly about one of the things that Dr. Ali talked about when she spoke about trauma-informed care. She was speaking on from the front parking lot to the back parking lot, and individuals may be wondering why she's talking about parking lots and trauma, and that's because one of the principles of trauma-informed care is ensuring that there is safety, and safety does not start once the individual is in your door. It actually starts when they're coming to you. So ensuring that individuals feel safe to actually walk into your door is actually one of the principles of trauma-informed care. Go back to, as it relates to the examples of the funded projects, one of the funded projects that we funded in the area of wellness was the development and the implementation of a grassroots psychosocial group-based workshop created for and by transgender women of color to enhance well-being amongst the community members. And what that looked like was the organization actually built the curriculum to actually carry out this project. And I also did various trainings before actually creating that curriculum to ensure that it was trauma informed, and also I also incorporated principles of harm reduction. As it relates to trauma-informed care, we have funded a project that developed an organizational and regional trauma-informed care capacity building project to support and to provide trauma-informed care services and create a train the trainer in the region. And what that project looked like was a train the trainer model. First organizationally, where the organization is working internally to actually ensure that everyone is trained and trained in these principles and understand those principles. And then what they would do is then provide, services to other organizations who would like to be trauma informed. Also, we funded, as it relates to mental health and substance use, we funded an organization to expand the work of their community health worker program to increase mental health and substance use referrals. And what that looked like was training around some principles of mental health, motivational interviewing, trauma-informed care, and also to actually better serve communities, and then also trainings and consultations around whatever the specific mental health and substance use referral would be. As it relates to the area of telehealth, we funded an organization to expand their mental health services to help break down barriers of transportation and accessibility for the Latinx community. And with this project is one of the things that is important to note is that when developing these programs, it's important to first understand that it is a need within community, and the first way to understand that is actually going to community and speaking with community before actually developing the project. And those are just some examples of some of the funded projects that we have funded through our initiative for the first cohort. All right, so as it relates to some of the key dates, as it relates to the Transformative Grant, as you all may know, the grant is currently open and we are accepting requests for proposals. We had our first webinar, which is our general webinar about the whole initiative as all three CCs came together on on August 22nd. We did a second iteration of the same webinar the following day. One was a morning webinar and the next one was an afternoon webinar. This week we're doing our center-specific webinars for each one of the CCs. And we are closing out the application process on September 23rd at 11:59 Eastern Standard Time. That's 10:59 Central Standard Time for everyone who's in Central Time Zone like us. As well, we will be notifying applicants an embargo notification of the funding decision around November 8th. And with this decision, we're asking the funding organizations not to announce their funding status because we will have a public notice announcement that will go out in recognition of World AIDS Day. As stated prior, the grant period will begin on January 1st. We will also have a convening on in February of 2020, and the partner convening will be an in-person convening. It's tentatively located in New Orleans now, but organizations will get more information as that time approaches. And then the transformative grant period will ends on December 31st, with the final report due on January 31st. All right, and at this time, if you have any questions, we're asking that you please enter your questions into the chat box, and we will get to questions as quickly as we can. I know that we currently have a couple of questions that have already been asked in the chat box. And the first question was around the recorded webinar. We will be recording the webinar. We will be providing slides. The slide deck would not be provided. However, the recorded webinar will be posted. I posted the website in the chat box in which it will be posted, where the websites will be posted. The webinars will be posted. And I am so it will be at the top of the chat box. I'm about to post that website into the chat box now for everyone to see. The second question, about PrEP. Say informing people about their health includes discussing PrEP. Is that not allowed at all? For this so it would depend. We would need a little bit more information regarding the project to say if that would be allowable or not. So if you have specific questions around that, just send an email to the info@gilead.com. The second, we have another question that says, hi, I see that one of the examples is very close to what the proposal I am working on in terms of interest, and wondered if I may get in touch with the wellness group to learn more if possible. I'm not exactly sure who the wellness group is, but just email me and email me at and I'll type my email address in the chat box for you to email me around that. We have another question about what is a CAB. CAB is an acronym that stands for a Community Advisory Board, and with a Community Advisory Board is comprised of individuals who represent the community in which you're serving, who informs your project, and who not only informs your project but is involved, who should be involved in all levels of decision making as it relates to programs that will be relative to those individuals. Can the grant money be used to pay people living with HIV per the economic justice objective? Yes. If they are working on the proposed project, yes, that is an allowable expense. Where do we complete the organizational assessment? So as it relates to the organizational assessment, the organizational assessment will only be given to those organizations that are funded. So the organizational assessment will be given to orgs once they're funded. So this is nothing that organizations have to worry about at this moment. All right, next question. Hello, will the trainings that we feel our staff needs have to be trainings done by you all? If so, how will we be notified of those so that we can write the proper trainings and the cost into our grants? As it relates to the trainings, we do have consultants that we work with that we can provide consultancy. As it relates to who the actual trainers or trainers are, those do not have to be written into the proposal. However, those trainings that you are thinking about doing, those should be written into the proposal. For example, if you're proposing to incorporate trauma-informed principles into your organization, you would need to incorporate within your proposal the training and consultation that will be needed to learn those principles and to incorporate that. However, who will be providing that training and consultation does not need to be included in the proposal. As it relates to including costs into the budget of the proposal, you can include a guesstimated cost, what that would be, or you can contact some consultants to get some ideas of what that would look like. Next question is, are the projects to serve only persons living with HIV, or may it serve those vulnerable to HIV? And the answer to that is both. Projects could serve individuals who are living with HIV or individuals who are most impacted by HIV, or a combination of both. Where can we get a copy of the work plan guide? You can download it with the application. It will be at the Gilead. Once you go in, once you log in and put your login information into the open water system, which is our grant system, you will be there will be prompts to download that information. Next question is, for first-time grant writers, is there someone at the center to help us think through how we incorporate the pieces through writing, as this sometimes can be overlooked by a first-time writer? As it relates to speaking specifically with organizations, we will not be able to actually specifically speak to you. However, what we could do is provide, if you would need some grant writing resources, we can provide resources, and just send an email as it relates to that. Can one agency apply for 2 Compass grants under 2 different tracks? For example, one with trauma-informed care and another with capacity building with Emory. Sorry if you already answered this. Okay, it's okay. As it relates to the transformative grant, you are only allowed to apply for one coordinating center. That means if you're submitting a grant, you only can submit one grant to either Emory, University of Houston, or SAC. You cannot submit a grant to more than one organization. All right. Are there any? Okay. I see another chat. It says, does that apply to core grants and transform? So as it relates to other opportunities, it does not. So if you're applying for a transformative grant, that does not mean that you can't, that means that you are still eligible to apply for a core grant, a spark grant, a learn grant, a action grant, or any of the shared opportunities. You still can apply for those opportunities. As it relates to transformative grants, you are only allowed to apply to one grant. And I believe I have gotten to all questions. Are there any other questions? If there are, just please enter your questions into the chat box. All right, I am going to enter my email address into the chat box if you have any questions. Please understand that I cannot answer questions as it relates to specific eligibility, meaning like, is a project eligible to be funded, or will a project fit into will the project actually fit into the content area. But I can answer questions that around things that are unclear as it relates to requirements. I see a question in the chat box. I'm actually entering my email address into the chat box now. I see another question that just popped up. How much of the funds can go towards a salary to run a program if the person volunteered their time the year prior? So as it relates to salary, we have a cap of, let me actually go specifically to the RFP. We do have a cap as it relates to salary. And I'm going to go specifically to the RFP to let you all know. Just a moment, please. As actually, I stand corrected as I go back and look at the RFP. There is no cap on salary. However, we encourage proposals to direct as much money as possible to the project implementation and the project deliverables, as it relates to the budget.